What are some of the advances in bone grafting that you use in your practice?
The bone is the foundation of the dental implant. So in patients where they don't have enough bone, we have to place bone in these areas to hold the implants in place. Bone grafting is a very common procedure that we do in most patients that require dental implants. It's a fairly minimally invasive procedure, and the science behind it now is allowing us to do it more and more for most patients that would otherwise not benefit from implants. Traditionally, bone grafting has been done where we take the bone from the patient and place it in various areas where it's necessary. If you want to do something like a dental implant, we need to build up the bone in order to accomplish this in some situation. With some of the advances in bone grafting, we now don't have to take bone from the patient. The benefit to that is we don't have a separate surgical site where the patient has to heal. In the past, we've had to take bone from the back part of the bottom jaw or the front part of the bottom jaw, but now we have better options as far as bone graft materials that we get from a bone bank. There's a material called BMP, which is the closest thing to the patient's own bone, which we can now place in various areas. In certain situations where patients have severe bone defects, we need to take bone from their body, and a lot of times this is done from their hip. At Austin Oral Surgery, we have multiple doctors which we have the ability to go to the OR with to do this type of procedure because it does require sometimes 2 or 3 doctors. Hip grafting is considered advanced bone grafting, and we use these in cases where patients have severe bone defects. For example, when patients require multiple implants to replace a denture, we would use hip grafting to do this. It's fairly rare for a patient to require this level of grafting, although we do have the capabilities to do this in this practice.